Melanocytic lesions. Melanocytic lesions may be benign melanocytic lesions or malignant. And the malignant melanocytic lesion is called melanoma. First of all, we'll discuss benign melanocytic lesions. Benign melanocytic lesions are also called pigmented nevi or moles. Pathologically, benign pigmented lesions, benign melanocytic lesions is actually hamartoma. What is the meaning of hamartoma? Hamartoma means benign tumor, like malformation. And this melanocytic benign lesion is due to hamartoma in the cells which produce pigmentation in the body. These cells are called melanocytes. And pigmented nevi or moles usually appear at birth or soon after birth or in childhood. The origin of these pigmented nevi or moles is melanocyte. Melanocyte which form melanin, responsible for the color and pigmentation of the skin. What is the site? Pigmented nevi or moles may occur in any part of the skin, and less commonly and rare to occur in mucous membrane. What is types and the clinical picture of pigmented nevi and moles? First of all, in normal skin, this is the normal. The normal skin consists of epidermis and dermis. In normal skin, melanocytes appear as clear cells in between the basal layer of the epidermis. The basal layer which rests on the basement membrane, and in between the basal cells which rest on the basement membrane, there are scattered large clear cells called melanocytes. These melanocytes normally present in any human body. They become increase in number. Melanocytes increase in number in layers of the skin. If the melanocytes increase in the layers of the skin, they will form pigmented nevi or moles as follows. The first type of this lesion is lentigo. Lentigo usually occur in elderly people. Melanocytes increase and replace the basal layer of the epidermis in certain area. Therefore, example, in this area, the basal layer of the epidermis is replaced by melanocytes. Therefore, in certain areas, the basal layer of the epidermis, all this layer, is completely replaced by melanocytes, and this is called lentigo. This will form in elderly people, a brownish, fillet, or rarely black area, usually brown, light brown, rarely becomes black, and flat at the same level of the skin. This is called lentigo. The melanocytes replace the basal layer in certain area. The most famous lesion is this. What is this? This is called nevus. The nevus develop in 3 stages. From childhood to young adult to more and more adultry and elderly people. In childhood, junctional nevus develop. From its name, junctional. What is the junctional nevus? In childhood, proliferation of melanocytes. Proliferation of melanocytes in the junctional zone between the epidermis and the dermis. This is the dermis. Therefore, in the junctional area between epidermis above and the dermis below, melanocytes proliferate and project into the dermis. This is called junctional nevus, and this is the beginning of the development of the nevus, which start to develop in childhood. Junctional nevus like lentigo, fillet, pale brown, fillet or pale brown, or black in color, at the same level of the skin. After many years in adults, compound nevus develop. What is the compound nevus? From its name. Compound means in adult life, melanocytes continue to proliferate from the junctional type and proliferation occurs. Proliferation occur in the junctional zone between epidermis and dermis, and melanocytes migrate, many melanocytes migrate to become in the dermis. Presence of melanocytes in the epidermis and in the junctional zone and in the dermis, this nevus is called compound nevus. Compound nevus because melanocytes present in the epidermis, junctional zone between epidermis and dermis, and in the dermis. Sometimes this compound nevus show hair growth from the surface, and compound nevus is characterized by elevation above the surface. Why elevated above the surface? Because melanocytes migrate and push the surface of the skin above it, leading to this light brown or black elevated area, and sometimes the hair grows from the surface. Rarely, this type show extensive proliferation of melanocytes in wide area, leading to this. What is this? This is called giant hairy nevus. Giant hairy nevus. This is a compound nevus. In older adult or in elderly, melanocytes totally migrate to the dermis only. This melanocytes leave the surface, leave the epidermis, and all melanocytes migrate to the dermis. This is called intradermal nevus. Intradermal nevus. And also intradermal nevus, the melanocytes push the skin above, leading to this elevated area. Therefore, compound nevus and intradermal nevus clinically have the same features. Pale brown or black raised nodule appear on the surface of the skin. What is the complication of nevi? If there is cellular proliferation of cells may turn to malignant. In these types, what is the cells proliferating? This stage, junctional nevus. Proliferation of melanocytes in the junctional area, or in this compound nevus. Compound nevus, proliferation of cells in the epidermis, junctional area, and in the dermis. And the most dangerous is this giant hairy pigmented nevus. This is the most dangerous, which may turn malignant. Also, nevi is dangerous if undergo chronic irritation, like nevus in the shaving area in males. Nevus here, and during shaving every time it undergo friction, injury, wound, irritation, leading to chronic irritation in this nevus may turn to malignant. What is the investigations needed for this nevi? Dermoscopy. Dermoscopy is an instrument which magnifies the lesion, allow the doctor to examine the skin lesion. If benign pigmented nevus is suspicious for malignancy, excision biopsy is needed. What is the treatment of nevi or mole? The usual treatment, leave alone, undisturb any nevus, leave alone, except in the face and in females which have cosmetic problems. Nowadays, we can treat nevi by laser ablation. This is the main line of treatment, laser ablation, especially cosmetically in the face. And there is another line of treatment in the bust, can be used in any area except the face, which is surgical excision. Surgical excision is available and easy for any nevus in any area in the body. But to remove a nevus nowadays in the face, leaving a scar, especially in females, this is not accepted. Therefore, especially all over the body, laser ablation is available, but slightly expensive. Therefore, in the face, cosmetically, laser ablation is the best. In any area of the body, for economic reason, we can remove the nevus surgically. If cosmetically we remove the nevus with 2 mm safety margin. If we remove the nevus surgically for suspicious of malignancy, remove the nevus with 2 cm safety margin. Also, we can remove nevus undergo chronic irritation by surgery to avoid a change to malignancy. Therefore, the main line of treatment is laser ablation nowadays, especially in the face, and surgical excision in any part of the body is available for cosmetic cause, suspicious for malignancy, or in area with chronic irritation. This is the nevi or moles. Thank you for good listening and good luck.